a treat for me. And as you can see, for those of you that are watching this episode, I broke out my cowboy hat. We used to call them 10-gallon cowboy hats. Now they're measured by X's. And I broke out this hat in tribute to my very good friend Don Self, who is joining me today from down in Texas. And Don wouldn't be dressed without his hat on. So welcome to the program, buddy. It's good to see you. I can't wait for us to kind of get into this conversation today.
Thank you, buddy. I'm looking forward to it.
Yeah. I was gonna start this episode with a song, Friends in Low Places, but I got Don on here and it would have to change to I've got friends in high places. So um let's go ahead and jump into this thing. So Don, you and I have not been around each other in a lot of years, as actually last time I saw you was before the whole public health emergency.
Yep.
And you've not aged one day, as far as I can tell, but we both had an opportunity to get together and spend some time in Las Vegas last week at the American Medical Billing Association AMBA annual conference. And boy, I'll tell you what, it was a treat to walk in and see you sitting right next to my good friend Robert Lyles.
It was great to see you too, partner. I always look forward to those things in person where I can get to see you and Robert and other friends.
Absolutely. And you know, it's nice to see everybody getting back into the live programs because I think for me, putting all things aside, I think for me, that's one of the things that I missed the most during the public health emergency was that human contact. You know, getting together, on a video chat, it's not the same thing.
Yes.
It's just not.
And when I'm teaching, I've noticed also when I'm teaching live seminars, I feed off of the audience. And I can hear their laughter. I can see their faces. I can see when they're confused because I said something that's going to confuse them or something. And I miss that.
Yeah, I agree with you 100%. I'm one of those that I feed off of the audience. Um, I get a ton of requests like you do. You get more than me every year, but I get a ton of requests every year to, speak for this association, that association. But hey, we're doing a webinar or we're doing it, like a Zoom or a go-to meeting. And I've turned several down because I've explained to them it's not that I don't want to speak for you. I do. I am just one of those that I have a very hard time sitting here and not seeing the people that I'm talking to because I feed off of their energy. And, I know, like to your point, I can look at people and if I see them drooling, I know I've got to do something to wake them up. Or if I see that look like, what? I know that I've got to give a clarifying statement to get them back into the wheelhouse with me. Um, so I've angered a couple of associations by saying no, but I've said to them, I hope that when you get back to doing things live, you'll consider me then. And whatever. But you know, last week was great in Vegas. There were a lot of great presentations. Ron Chapman, Eric Rubenstein, uh, obviously Robert Lyles, yourself, Darren LaCroix, who gave the opening keynote address, he was pretty funny. And hearing his story about owning a Subway and $60,000 to open it, and 6 months later he was in debt 120,000 and sold it for a loss, but it was the best day of his life. And just kind of going through that, but getting a chance to network with the vendors and network with the attendees. You just can't replace that.
Yeah, I agree 100%. And plus, on top of that, when I'm at shows like that, I'm learning. I learned a lot from you, Robert Shannon, DeConda, Ron Chapman, and the others. Like you said, not only is it
Yeah.
networking, but I like to learn from everybody.
It was actually funny you brought up Shannon. I apologize for not mentioning her in the distinguished list of folks that I mentioned, but it was actually funny because I walked in right as she was starting her session, and I saw her look up, and she saw me in the back, and she was like, "Ugh, God, why is he here?"
I got to tell you a quick story, if that's okay. Years
Of
ago,
course.
it's probably been about 25 years ago. I was speaking for the American Osteopathic Association in San Diego. No, Los Angeles. I think it was Los Angeles. And I heard that Terry Fletcher was doing a seminar down there in one of the hotels for Terry McVeigh at the time. So I showed up at the hotel, and it was a couple hours after the seminar had already began. She's up in the front of the room, and I walked back in into the back of the room and sit down in a chair back there, and I didn't say a word. And she's sitting there talking and speaking, and every once in a while I see her looking back at me, and here I am sitting there, obviously in my hat. And then she finally stopped and said, "Is that Don Self back there?" And I said, "Yes, it was." And if you know Terry, to watch her come running up the aisle was absolutely amazing. She ran up that aisle and gave me a big old bear hug.
Oh,
But
yeah. I love Terry. Terry's one of my favorite people. You know, she and I do a weekly segment called hashtag Terry Tuesdays, and we always have a lot of fun. We get to, pick at each other a little bit, and we talk a little bit about football and some of the other stuff, and then we get right into talking about fraud, waste, and abuse, and coding and billing. But it's funny you brought up Terry McVeigh, and I think we all kind of cut our teeth on McVeigh back in the '90s. Um, Terry was an interesting character, and I wanna start because I know you're at what, like 38, 39 years that you've been in this industry now, right? And you're somebody who I've always held in high regard. We've shared a lot of mutual friends over the years, the John Bishops of the world, as you said, Terry Fletcher, Terry McVeigh, the list goes on and on and on. But, w what got you into healthcare? What was it that made you say, "Hmm, healthcare. Now that's a place I wanna go."
it's kind of a strange way that the way God got me into this business. I wasn't planning on getting into the healthcare. In 1983, I was selling cars in new Buicks at a Buick house over in Fort Worth, Tyson Buick. And a guy comes in and buys the car from me, wants to buy a car from me, and this was in, well, I'm sorry, in mid '84 when the '85 Park Avenues came out. And he said, "I want you to sell me this Park Avenue right here." I said, "I'd like to, buddy, but my boss won't come off the price. If I was you, I'd go over to Vandergrift in Arlington, and this is how much I'd pay for it." And I sent him over there. And about 2 or 3 weeks later, he calls me up on the phone and said, "Hey, did you get a commission on that?" I said, "I wasn't going to get a commission. I sent you to my competitor. I told you then if you ever need something, you call me first." He said, "So you didn't make anything on that?" I said, "No, sir." He said, "You're an honest salesman." I said, "I try to be, partner." And he said, "Okay, I want to offer you a job in the healthcare field." I said, "Doing what?" He said, "Selling super bills and pegboard systems to doctors, ledger cards."
Pegboards.
So I went to work for him selling pegboard systems, and I did that for about a year, almost a year, and about a little bit over a year. And I finally said, "Man, these docs are sitting there telling me they want all these codes on the super bills." And I'm telling them, "That's not the right code, doc. They changed that code." Because I would go to seminars so I could be the best one putting out these forms on, and selling them so I could sell more. And after I did that, I went ahead and just opened up my own consulting business. And that was the beginning. And God has blessed me ever since. That's how I got in the healthcare business.
Now, I wanna go back a little bit. So when you got rolling, right, you were traveling the country in a Winnebago, if I'm not mistaken, weren't you?
Not at the very beginning. I was getting air miles with everybody at the very beginning.
Okay,
I was
fair enough.
platinum with everybody like you back then. But I got to tell you, since you brought up Terry McVeigh,
Yeah.
before I went off on my own and left, at that time I had a $30,000 a year job and a wife who stayed home with 3 children. She wasn't really nuts about me taking off on my own right there.
Oh, yeah.
I got together with Terry McVeigh on the phone and said, "Terry, I'm thinking about doing this. I've been watching your seminars and all." And he said, "Don, I recommend 2 pieces of advice if you do it." I said, "What's that?" And he said, "Number one is always guarantee everything you do. And number two, make sure that your clients get more in service than you get in compensation.
It's
And
great
I
advice.
lived by that. Well, about 3 years ago, 4 years ago, I called Terry McVeigh when I was out in California, said, I want to take you to lunch. And I reminded him of those two things, and he didn't remember those, him telling me that, but I told him it changed my life.
No, and it's great advice because, that's one of the things that I feel like has always set me apart from a lot of the competition out there is because I wear my emotions on my sleeve,
Yeah.
one, and, I always try to go above and beyond for my clients. I don't rest until I know that I've done everything in my power to ensure that, 1, their practice is compliant. 2, if they are subject to audits, that I've done my darndest on their appeals to make sure that I've given them the best possible arguments on an appeal. And 3, if I'm going into a courtroom, that I am putting myself as the person on trial so that I know I'm fighting every single step of the way and I'm not resting until I've taken my last breath in that case. And you're right, your clients need to feel like they've gotten more than what they've paid for. And that's great advice, especially for the young generation coming up now
Oh, amen.
who, I'm catching up to you in the whiteness. Right? And for the people listening out there, when I say whiteness, I'm actually talking about our beards.
Yeah.
Um, I'm starting to catch up to Dawn on that right now. Because, I don't know how much longer I'm gonna be around. I'm at 30 years and, it's been a tough 30 years. Like you said, I've been diamond medallion on Delta, 2,000,000 miles plus,
Wow.
Global Express on United Healthcare, another 800,000 miles on them, and, I'm tired, Don. I'm physically tired.
Well,
But
you're right.
so you started Don Self and Associates, right?
Yes, sir.
And like most people, when you start a company and you say Don Self and Associates, you're really talking about Don Self, me, myself, and I.
At that time, it was just me. Yes, sir.
Yeah.
And
And,
in fact,
you built.
and when I
Yeah.
first started the company, I was I was throwing a newspaper about at 5 in the morning. I was painting house numbers on curbs on the weekend, and I was taking 16 hours of college at school classes so I could get my veteran benefit of $560 a month to help pay the bills and
It it
do what you had to do.
it's unbelievable to think back, right, into the '80s when and this is the time frame that you're talking about, right?
In the mid
To
80s, yes.
think back to that t yeah, to think back to that time frame and to think about where we are now in 2023 and the lack as a majority in this country that is demonstrated for people willing to work hard. It's frightening.
It is. It's frightening, especially when you look at young people today and what they kind of expect. I'm going to get out of college and go start a job, or I'm going to start making big bucks at the very beginning. And you got to work to do it, and you got to fail so much so you can learn from the failures, just like you learn from your successes.
I have a really good friend who is a retired professional rugby player. And we were just actually talking last night. He's over in the UK. And we were talking last night and we were talking about sort of, you know, his climb, right? You know, professional athlete, his career ends, he kind of hits a hard spot, with certain things and kind of went off the deep end and, lost, houses, lost money, lost this, lost that. But, he has found his way back, right? To reinvent himself, to, climb above even where he was as a professional athlete. And, the thing I said to him was, what makes a champion isn't the number of times you get knocked down, but how many times you actually pick yourself up. And, that's the thing to your point. So many of these youngsters today, and I call them youngsters because I'm 50 years old now. Some of these youngsters who, come out of school, to your point, feel like they're entitled to make 75,000, $100,000 a year as their very first job, and if you don't pay them that, then they're not gonna come and work for you, and, I just don't know where this mindset has actually come from.
I have no idea. I have no idea. I wish I knew. I mean, it's just not the way I was raised. I mean, when I was 12 years old, I was cleaning shelves for 25 cents a shelf at the store. You know, so I've always been working. I think I don't know if I ever tell you my first job was when I was 9 years old. I borrowed $50. I mean $5 from my dad, and went and loaded up my wagon full of Aussie colas. Aussie came out with 16-ounce bottles back then, and I dumped ice on them, and I pulled them to these apartments that they were building right next to the apartments we were living in, and I was selling them to the workers for a quarter each. And when they'd get off work, I'd go back and pick up the bottles and wash them out and take them back and sell them for 3 cents each. And the first day I paid my dad back, and within about 2 weeks, I had two 10-year-olds working with me, working for me, really, and
That's crazy.
pulling wagons. And it was fun.
That's the American exceptionalism that, Ronald Reagan talked about, that, um, the first Bush talked about, right? We haven't heard much about American exceptionalism in a long time. And, this podcast, even though you and I have known each other, for the 30 years I've been in healthcare, um, this isn't a podcast about coding, billing, or compliance. This is a podcast about an individual who was blessed to be able to find something that he loved and to make a career out of it, because not many people today, and probably over the last decade, can actually say they're in a career because that's what they love. Most people are doing what they're doing because it's a paycheck and it pays the bills.
And that's sad. That is really sad. But like you said, I love what I do. I don't feel like this is work, and I plan on doing it until the Lord says, "Okay, you need to stop," and I'll hand it off to my son, who's taking over my business, and I'm teaching, or God will take me home, one or the other.
So I got a chance to meet your son the other day, and when I walked in, I was like, "Oh my god, that's Don from 30 years ago, man. Your son is a spitting image of you."
That poor kid, he's going to look like this one day. I feel so sorry for him.
Have you bought him a cowboy hat yet?
I bought one for him, but I'm not sure he wears it as often as I do.
Well, I'll tell you what, if you want another adopted son and you wanna buy me a nice, beaver skin hat, I will wear it all the time, my friend.
There you go. I like that.
So so let's talk about, you started your business and, obviously, it back then, we didn't have the internet, we didn't have the LinkedIn, we didn't have Facebook and Instagram and TikTok and all these other social media platforms, Twitter, which is now X. You know, how did you get your name out there? And how did you build what became ultimately an empire?
Well, I don't know about an empire, but thank you.
Oh, come on, Don. You're being too modest.
Well, I got a couple of folks out there that listen to me, and that's been a blessing. But I guess the way I got started first is I got some business. Well, first off, my first desk was a door laid between on top of two boxes in my dining room. That was my desk. And I rented a typewriter because I didn't have the money to go out and buy a typewriter or a computer at the beginning. So I got these business cards, and I would go out and hand out business cards to the doctors. And what really, I think, propelled me forward, really helped me big time back then, was Diana Finley was the director of the Texas Osteopathic Medical Association. And she contacted me about going and speaking at the TOMA convention, and said they'll give me a booth and I can exhibit if I'll come speak. And I said sure. So and apparently one of the doctors had told him about a seminars I've been teaching around Tyler, Texas area, the hospital here that put me on, let me put one on. And I started speaking for them. And then I started opening all the doors at the Texas Osteopathic Docs. And then Oklahoma reached out to me, and Florida reached out to me. And pretty soon I was doing probably 25 DO conventions a year around the country. And we were traveling a lot. I was traveling a lot in airplanes then, because we didn't start doing OVs until around 2007, where I started pulling OVs around and got out of airplanes. But that's what really started me propelled forward. I got my name out there. And then I built the donself.com website because people would say, hey, I want to share these forms with others. I said, cool. I created a website called donself.com in 94, I think it was. And people would donate forms to me, and letters and appeal letters and everything. And I'd put them all out there for people to download for free and just use. And that kind of helped keep my name out there. So between the Toma and the website, it's just, I've been very, very blessed in getting a name out there.
Yeah. Let me ask you, so, my program, I always like to talk about faith, right? I like to talk about family, because I think it's so important. I think that's, faith is what's missing in a lot of respects
That's
from
true.
people, in their heart, in their minds. You know, I know I've always known you to be a God-fearing man, but, you know, what drives your faith? What drives you? I mean, I know a lot of folks that get into healthcare, and let me clarify my question a little bit. I know a lot of folks that get into healthcare, get into it because it's a $3.3 trillion industry, and they believe that there's just a ton of money to be made. A lot of folks get into healthcare, especially on the clinical side, because they're compassionate. They have a love for science, they have a love for humanity, they want to do no harm, they wanna take care of people. But we have always been, and when I say we, you and I, we've always been on the business side of medicine. Times are not always great, right?
Yeah.
Healthcare from a business stance could be very cyclical. When you have gone through those tough times, right, especially in the mid '80s, coming into the '90s, the 2000s, you know, when times got a little bit lean for Don Self, how did you pull yourself through those times? What did you lean on?
Well, I definitely leaned on God, first off. Uh, I felt very, very blessed by God in so many ways, through my family, through uh, watching others that I was around getting blessings from God. Um, I had a preacher teach me one time. It's not, we don't give back to God what is ours. We give back to God what is His, and He gave me ability to be able to consult or to sell or to help the doctors. Then I would be disobeying Him if I didn't do the very best job I could in using that ability. And that's honestly how I've always looked at it right there. And then I've had a wife who's unbelievably supportive. I mean, when I told her I'm going to leave a $30,000 a year job, which at that time in the mid '80s, 30,000 wasn't bad money. Okay,
No, that was good money.
I was doing good selling super bills and charged ledger cards and day sheets and stuff. And I told her I'm going to leave that and go off on my own. She said, if you believe this is something God wants you to do, then I'm behind you 100%. And she was a stay-at-home mom raising children, and I've had unbelievable support from her. And so that's kind of it. I mean, God and my wife has just been the reason that I'm here.
Yeah, it's so interesting how parallel our lives have been. Um, because in all sincerity, you know, um, I started working for Medical Management Institute, which you probably remember from way back in the '90s.
Oh yeah.
And my first job working for them was $32,500 a year. That's what I was making. And, I was a kid, right? We're talking, almost 30 years ago. And it was pretty good money, right? Because I was living on the road, and, I had an expense account, and really, that 32.5 after taxes, I'm probably getting about $27,000 a year. And, that was just pretty much going into my bank account. But, you get out onto the road, and, you're faced with a lot of temptations, right? When you're not at home, you're faced with being alone. And, for me, I got depressed a lot being out on the road, by myself, from 8:30 in the morning till 4 in the afternoon, you're surrounded by a bunch of strangers and it's really putting on a show, right? I mean, 75% of the reason why people were there was to be entertained. 25% of it was because they were actually interested in about coding and billing and Medicare regulations.
I
And
believe.
then, you pack up and you head to the airport depending on how far your next city is, and you fly to that next city, or if it was within 3 hours, you drove to that next city because it was faster than going to the airport and all that nonsense and boarding planes and all that. But, you get to your hotel and, y you go to the bar and you sit down and you're sitting at the bar and you order your dinner and the bartender's like, "Hey, let me buy you a drink," because 'cause you're having a great conversation. And, so you have all these different types of temptation. But, to your point, as you were saying, you leaned on your faith. And, I had to learn about faith, right? Because the family that I grew up in, there wasn't a whole lot of that. It was just kinda, fly by the seat of your pants. And when I met my wife is she was into the book. She was very much into, you've gotta walk the walk. You can't just preach. You gotta heed your own words. And, it took me a little while to get, to that point to understand where she was coming from. But, I said to her, at the point when, we finally got married, my income was starting to get a little bit better, right? Because I was getting, bonuses, and I was getting, commissions on, the book of business that I was generating, things of that nature. And I said to my wife, I think at the time when I said it, it was 2003, I was making 6 figures a year, which, was good.
Yeah.
I said, "I'm leaving my job." She goes, "You're doing what?" I said, "I'm gonna start my own company." And she said, "And what are you gonna do in that company?" I said, "Everything that I'm doing right now for my old employer." And it took her a few minutes to get her head screwed back on right after it popped off. But she looked at me and she said, "Do you believe in yourself?" And I said, "I do." And she said, "Do you believe that you're being called to do this?" And I said, "I do." And she said, "Then I'm behind you. Let's do it."
That's
Boy, oh boy. If I knew 6 months later down the road what I had embarked on, I probably would have stayed right where I was at.
it's scary. It's scary when you take off on your own like that.
It is.
But
It
you
is.
had her
But,
support, you had God behind you without, and I don't know if at that point you knew how much you had God behind you. But it says what it, I forgot where it says it, but he knows what his plans are for us. And these plans are for good. And even though we don't know what they are, he does.
you know, um,
Jeremiah 29:11 is that? Yeah.
okay. You know, I will say this. You know, I have, as I've gotten older, um, I think I have found more faith, and I've learned to lean on that faith more. And I have come to realize and recognize that the good Lord will never give me anything more than what he believes I can handle.
Can I correct that? Can I add to that if I may?
Yeah, please, correct me or add to it, please.
I believe that God will give you, allow you to take on more than you can handle so that you will be forced to turn to Him to handle it for you. Does that make sense?
Okay. No, it does. I mean, listen, I take my walk with the Lord, and I explain to people. I get asked a lot, why don't you come to my church? Why don't you come to this church? Why don't you come to that church? And not anything against folks who go to church. I have nothing against anybody who goes to church, but for me, I feel more at peace when I'm in the Word myself. I'm more at peace because I know I take my walk with the Lord. And, I feel his presence and I feel him speak to me, and that's what I need, right? I don't need four walls and some folks who are telling me how to live my life when they don't live their life the right way. That I should be doing things differently. So, anyways, I know there's arguments on both sides. My wife always yells at me and says, "Sean, church is about getting the word. It's not about the people. It's about getting the word." After you get the word, then you can do fellowship and all those things, but get the word. And I'm like, "Well, I get the word sitting right here in my office when I close my eyes and I say, 'Dear Lord, what did I just do?'"
Yeah, he speaks to us all the time in so many ways. And like you just said, God is not in a building. God is all around us, wherever we happen to be, you know?
Yeah. So, you set out with Terry McVeigh and you guys conquered the world. Well, you conquered healthcare in the United States during the 90s, right? You always kind of maintained your autonomy, right? You always had Don Self and Associates, I think dating back to what did we say, the mid 80s?
Yes, sir. Mid 80s, 85.
Yeah, 85. So, you know, Don Self has obviously had to adapt as healthcare has changed, right? Otherwise, you find yourself like the dinosaurs.
Amen.
Um, and, you know, talk about what you have seen as an evolution in the healthcare space from the 80s to the 90s to the early 2000s to where we are right now.
Wow. Okay. Go back to the 80s. It was a simpler time. Whenever a patient would go to the doctor, they would give them a couple of receipts, pay the doctor for today's service, and then the patient would file their own insurance by stapling that receipt to a claim form and mailing it in. And then in the late 80s, around that late 80s, Medicare started putting new restrictions on, saying, "Hey, we're going to have limited charges or the MAC charges." And around the 90s, you had Hillary Clinton and Bill Clinton saying the doctors are all evil; they're all making too much profit. And around the early 90s, we had the insurance carriers come back and start demonizing doctors and saying, "You've got to sign up with us. Let us help you pick the doctors. We're going to start all these managed care plans out there to kind of follow along what Kaiser had started back in the 50s." And doctors, again, were starting to feel demonized because patients couldn't pick up the phone, couldn't pick up a newspaper without seeing doctors are overcharging, doctors are making profit, and they shouldn't be making profit, which is absolute moronic idiocy because you can't keep the doors open if you're not making a profit. You can't pay the utilities and all the expenses a doctor has when they go into debt, like $160,000 back then, and today it's probably over 300,000. I'm guessing. I don't know how much it costs anymore, but and so I started seeing a change there where doctors started getting bought out by insurance companies or by large groups and hospitals, and they'd sell out to them, and then the hospital or the large group would drive the practice into the ground, and then 5 years later sell it back to the doctor for pennies on the dollar, and then they did that again about 7 years later, and then about 7 years later, and I keep seeing that trend. And overall, doctors are losing their autonomy, and they don't get to practice the way they want to. And it's just irritated the fire out of me because as a patient, like for instance today, if I want to go get osteopathic manipulation, I have trouble finding a doctor in Tyler, Texas area where I live that'll do OMT. I mean, I can go get chiropractic manipulation, which I do, and yesterday I had one and I will again next week, but I can't go get the kind of care that I want because these large companies have bought out the doctors and said, well, we don't make enough money doing that. So you're not going to do that service. And I guess it just irritates me that the doctors have not only lost their ability to do medicine the way they want to, but their income potential. And it's saddened me. And I don't know where we're going from here. I really don't. Is
What
that
do
more
you
than what
make
you wanted?
of what do you make of Medicare Part B saying they want to be out of the insurance business by 2030 and now forcing all of these Medicare beneficiaries to join these Medicare Part C programs um, that are um, administered by private insurance companies.
It infuriates me. I got on Medicare several years ago, and my wife is 64, turning 65 next year. She'll be on Medicare next year. And there's no way in the world I am going to willingly and voluntarily go over to a Medicare Part C plan because I know how much the copays are for the patients. And I know the first time I have, or the next time I have a heart attack, what it's going to cost me out of my pocket. So I'm fighting that for all I'm worth. I know CMS, like you said, wants to get out of the business by 2030. They want to get out of the med. In fact, I put that in this month's newsletter, which is something I learned from you and Robert Lyles, by the way. So I included that in this month's newsletter. That they want to get out of it, but I hope that they somehow somebody changes their mind because I think the commercial carriers out there are really screwing over the patients. Now, between you and me, buddy, I think there's two ways to make money long term in healthcare. One, withhold services, keep the money. The other is give good patient care today to avoid catastrophic costs later. And I feel like the whole managed care plan that we have right now out there with the insurance carriers and the managed Medicare, or as I call them, disadvantaged plans out there, Part C disadvantaged plans is to withhold care, which is why so many of them just got in trouble this last year for not for denying pre-authorizations.
It's so crazy. We're talking about these Medicare Part C plans, right? And my mother's 82 years old now, and she lives in Boca Raton, Florida. And she went to the dentist today, and the dentist said you need a periodontal cleaning, but you just had one last September, and your insurance only pays for a periodontal cleaning every 2 years. And my mother calls me on the phone and she says, I needed you to speak to the dentist. And I said, what do you want me to talk to the dentist about? She goes, just talk to him, please. So the dentist gets on the phone and the dentist says to me, well, your mother had a periodontal cleaning a year ago in September. I think she needs another one right now. I said, okay, so what's the problem? He goes, well, her insurance won't pay for it. They only pay for one every 24 months. And he said, "But she really needs it." And I said, "Well, has there been any further deterioration of her gums? Has are you seeing any further decay of her teeth? You know, what is it that's making you say, hey, she needs a periodontal cleaning?" He goes, "Well, it's just the right thing for her." And I said, "Well, I understand that. You believe, as her dentist, that a periodontal cleaning is the right call. I'm asking you why." Because apparently, and I'm not saying I agree with the insurance company because I don't, but there's a reason why they believe a periodontal cleaning should only be done once every 24 months. He goes, well, listen, you can have it done at a frequency greater than that. She just has to pay for it. I said, well, if you believe that she needs to have it done and the service isn't covered by her very good insurance plan, by the way, because I picked it and I know what it is, well, then why don't you pay for it? And he goes, why would I pay for it? I said, why do you want me to pay for it? And I mean, it's kind of a stupid argument, right? But my point here is he said, well, your mother's on the wrong insurance.
Ooh.
And that's where I was going with this. And I said, oh, and I perked up. And I said, well, hold on. Let me kind of get my head on straight here for just a minute so I understand where you're going with this. And he said, she needs to be on a Medicare Advantage plan. And I said, she does. Why? He said, because they'll pay for it and they'll pay for it every year and they'll pay better than what her insurance pays now. And I said, listen, put your mother on a Medicare Advantage plan. Mine is staying on traditional Medicare Part B until they say there is no Medicare Part B any longer. People don't realize they watch these commercials on TV with J.J. Walker from Good Times and Joe Namath, the former, New York Jets quarterback, who come out and say, hey, you're going to get all these great benefits. You're going to get free meals and free rides and free this and free that. There ain't nothing for free.
Nothing. You're right. Absolutely. I agree with you. And it infuriates me that Andy Griffith and Kelsey Grammer and, like you said, Bill Shatner and the others on there telling these people. And all the time, I've got family members who call me up. Hey, Don, they wouldn't be saying this on TV unless it was true. Yes, they. It's not true. I'm telling
They're
you.
paid spokespeople.
Do you really think Bill Shatner knows anything about health insurance? I
Well, do
mean,
you think Bill Shatner's on a Medicare Part C plan?
yeah, right. That's a good way of putting it. I like that.
Yeah,
But
if you
here's
show me William
here
Shatner's Medicare Part C Advantage card, then we'll have a conversation about putting my 82-year-old mother onto Medicare Part C.
I agree, buddy. And in fact, I even have a letter that I put out there on my website for doctors to download and then print out and put in their reception areas saying why they would not be on Medicare because they can't tell the patients not to, but they can say why
That's
they
right.
themselves would not put a family member on.
That's right. That's right. So, one of the things that we've seen, I guess one of the last topics I want to broach with you, we have seen fraud, waste, and abuse become the big phrase, right? Along with culture of compliance. But fraud, waste, and abuse has really, over the last decade, maybe decade and a half, right? Maybe the last 10 to 15 years, really take front and center stage.
Yes, it is.
Thinking back into, the late 80s, 90s, into the early 2000s, I mean, there's always been bad actors, but I mean, did we ever really see the government going after healthcare professionals the way that they are right now for fraud, waste, and abuse?
Not back then the way they are right now. Today, I think back then, like you said, there were bad actors. And if there was something that somebody was doing, they was going after them. But I don't think they imagined or somehow pictured that, oh, everybody's doing it. And that seems to be the approach that they're taking today. And that's not the case. You and I both know doctors who are making mistakes that would think they're doing everything right, but they listened to somebody gave them some bad advice. I can think of several doctors that I've had to go in and defend. And yeah, doc, you were screwed up. You listened to the wrong people. But the doctors had no clue that they were doing something that was illegal or unethical.
Yeah, that's a conversation that I have with a lot of prosecutors these days, and, because I get called both by, you know, um, those who are prosecuting the cases and those who are defending it. And, I always ask the prosecutors when they call me if I'm willing to engage in a case with them, they always say, well, we've secured an indictment, through a grand jury. And I said, well, that's great. I mean, that's nothing more than a rubber stamp. I mean, you're the only one in there telling them that the doctors committed a crime. There's nobody in there having the ability to defend themselves. Because
Right.
if you put somebody on the other side to defend themselves, you're probably in 75% or more of these cases, you're not getting an indictment. You're not getting a true bill. You're getting a no bill.
Yeah.
I say, but I say to them, let me ask you, are we talking about intent that you can prove, or are you talking about mistakes that have been made? Honest mistakes. Because remember, the False Claims Act applies to lies. It doesn't apply to honest mistakes. The healthcare fraud statute is intent based, where the FCA is knowledge based. You know, you say that they intended to commit an artifice or scheme against the government, but you're telling me that the doctor billed a 99213 and the doctor billed a 99214 and the doctor billed 99212s, and you're not saying he didn't see the patients. You're saying that they upcoded the services. So let's talk about intent, because are they really enriching themselves? And look, we may be able to look at a series of claims and the documentation to go along with it, and we may be able to say, it's subjective, but you could kind of argue that maybe they should have built a 2 instead of a 3, but does that really rise to the level of fraud? And what we're seeing is less and less individuals going into medicine the medical schools, their enrollment for physicians is down. I mean, look at the fact that all of these Ivy League schools no longer require you to take the MCATs to get into medical school. Did you ever think in your life, Don, you'd see that?
No, I never thought I'd see it. I just saw headlines, was it yesterday, saying in the state of, was it Oregon? I think Oregon, that they don't even require students to be able to read or write or do basic math to get a high school diploma any longer because they felt like it was discriminatory. What are they doing? We're dumbing down our medical schools the same way we're dumbing down schools, high schools.
So why bother even going to school if you don't have to learn to read, write, or do arithmetic? Why do you have to go to school?
It's kind of like, the college. I have a grandson going to college right now, and I said, "What job do you want to have when you get out of college?" I have no idea. Then why are you going to college? Why not a trade school? Find something that you're interested in. He said, "Well, they're willing to pay for me to go to college, so I'm going to go to college." And that way he works part time. I mean, I just don't get that mindset.
Well, you and I are old timers, and we kind of look at things the way that we were raised to look at things, right? My granddaddy raised me, and he always said, these are the this is the way you view things, right? And you were raised in a certain way, and this is how you view things. And my family, they came through the Great Depression. They came through, multiple wars. They've seen the recessions, of the '80s, and the crashing of the markets in '08, and so we kind of look at things, I think, through a different lens. And listen, you want to go to college and get an education, that's great. Nobody could ever take that away from you, but don't become a career student.
Yeah,
Figure out what you want to do, right?
exactly. And have some kind
So
of an idea. But like you said, though, doctors are afraid to go to school right now because they hear of other people getting in trouble for something. I can name doctor after doctor right now that the OIG or Medicare or an insurance company went after them and said, well, maybe you didn't mean to do it, but we're going to ask you for this much money and you're going to settle for this much money. Otherwise, we'll toss all this other stuff on here. And I think a lot of these doctors, well, I'm going to spend another $1 million in attorney fees trying to defend me. So, yeah, I'll just go ahead and settle with you right here, and I'll claim guilty or whatever, or settle. And it's sad because, and then
it
they
is.
get out of the business, they get out of the field.
When we were in Vegas last week, Eric, Ron, and I, we were talking about this very thing during our panel discussion. And we
Hmm.
were talking about the fact that, the government relies on these things called local coverage determinations, LCDs, right?
Right.
And these are documents that are created in the local region, in the local market by a contractor to the Centers for Medicare and Medicaid Services. And they are basically sub-regulatory documents. They do not have the effect of law. They are not statutes, acts, or regulations. They are guidance documents. They are guidelines. And what we're finding in a lot of cases, especially desk audits done by the Office of the Inspector General, where they turn it over to the Office of Counsel of the Inspector General, they're using these things called strict liability findings, where they say, for example, facet injections. Facet injections, you can only do 5 in a rolling 12 months. Now, you have some regions that don't even have an LCD. Do you know, Don, that the federal government at the national level doesn't even have a national coverage determination on facet injections?
I didn't know
But
that.
then you have some LCDs in other regions where they say you can do 6. So there's inconsistency. Yet this doctor that Robert Lyles and I and Eric Rubenstein were defending against this audit that was done by OIG, the attorney for OSIG came out and said, listen, man, I don't care about medical necessity, because if it wasn't medically necessary, they wouldn't have done the first 5. But for everyone that they went beyond 5, they violated the LCD. And that's a strict liability. So here we go. I could either be nice and hit you with CMPL, civil monetary penalty laws, at double damages, or I can impose treble damages, 3 times the amount. You take the pick. I mean, there was no negotiation on this because they turned it into a strict liability. I mean, Did you ever think back in the 90s or early 2000s that we would have these LCDs that were so restrictive that doctors couldn't use clinical judgment and they couldn't determine medical necessity or use the treating physician rule to best determine how to take care of their patient? They had to rely on some yo-yo at an insurance company who probably, you know, didn't even have a medical degree, and they're making medical coverage policy decisions? I mean, really?
I never thought we would get to that point. I do remember a case in Dallas years ago where we went in front of an administrative law judge and said, and this was a Medicare case over there, and they said, well, the Medicare doctor said this right here. I said, the Medicare doctor is an anesthesiologist because I'd already done my homework. He's not an internal medicine doctor. This doctor right here, Dr. Daniels, is internal medicine. What does an anesthesiologist know about this? He didn't have special training in this area that the internal medicine doctor did. And the administrative law judge turned to them and said, are you really an anesthesiologist? He said, well, that was my training. And he ruled in favor of my doctor. And that's the kind of idiocy we're seeing still today because we're having people make decisions that are not doctors. That's why I love this ERISA law that we, maybe we should have sometimes have an interview about that specific law right there. I love
Yeah,
that.
we can talk about ERISA.
Do that. Yes, sir.
Yeah. So, last question for you, my good friend.
Okay, buddy.
Man, I just looked up and I was like, wow, we've been talking for an hour on this. This is great. Fantastic. Last question for you, and I'm going to ask you to be I'm going to ask you to be a fortune teller a little bit. Where where do you think we're going in this industry? What do you think healthcare is going to look like in the next 5 or 10 years? I think I'm asking you to be a prognosticator.
Okay. Well, if Jesus doesn't come back tomorrow, what's going to happen? I don't know, partner. I keep, especially with what's going on in the world right now, I keep asking the Lord, come on back anytime, man. I don't really know. All I know is that more and more doctors are selling out their souls to the insurance companies, and they're losing hope. It's like Mike Benavides that time. He said, hey, Don, I can't keep going the way I'm going right now. I'm not even taking a paycheck. It's getting to where I'm not spending time with my family. I got to do something. I don't know what. And I think that more and more we're seeing doctors have that attitude, and that breaks my heart, honestly. Because these are people who've given their life to serve others. Yeah, the money is good in medicine if you're working smart. Most doctors, they're not working smart. They're trying to work hard, and they're listening to bad advice. It scares me to think about where we're going to be. I never thought we'd be where we are today. 38 years ago when I started, when you and I started, I really don't know what direction we're going. I think the insurance carriers are going to keep trying to put the thumb on doctors. I think corporations are going to keep trying to buy out the doctors because they think they can run the clinics better than the doctors do. And very seldom do I find that being the case, by the way, very seldom. Sometimes it does, but very seldom. I think that
do you think we're ever going to see ourselves in a single, I'm sorry, I didn't mean to interrupt. Do you think we're ever going to see ourselves in a single payer system?
I hope not. But I think that that's probably down the road we're going to have about the same time as we, have a cashless society and other things that the Bible has already told us is going to happen. I think we probably will one day.
Yeah. Well, I'm getting more and more emails, and I'm not joking when I say this. I'm getting more and more emails from people who have become friends of mine in the industry from other industries. I got one just as recently as yesterday asking me, have I recently read the book of Revelations? And I said, well, I'd be lying if I said no. And I think more people need to read the book of Revelations because I think everything that was predicted in that and written about in that book, I think we're actually seeing that right now. But we'll keep our head on a swivel. We'll keep praying. We'll keep doing the right things. We'll keep fighting the good fight for the physicians, the nurse practitioners, the PAs that are out there. and I think in general, fighting the good fight for humanity.
I agree. That's all we can do is just do it day by day. It's kind of like, was it, I'm trying to remember what, Matthew 6:27 or something like that. It says, we can't worry about tomorrow. Tomorrow's going to worry about itself. All we can do is the best we can today.
That's right. Well,
I
in
like the
closing,
hat, by the way. I
in,
do
in
like the
closing,
hat.
in closing, I'm putting on my hat to pay tribute to my great friend Don Self. Um, I've so enjoyed spending time with you last week. It was pretty short last week in Vegas, but getting an opportunity to sit down with somebody who has been a trailblazer in the healthcare industry, who has been there, done that, seen it, lived it, and is still kicking the tires. It's been an honor, my friend.
Thank you, partner. It's always good to see you. I appreciate you a lot, more than you know.
Well, I appreciate that. All right. And to each and every single one of y'all who's tuned in, logged on, and hung out with us for just a little while, thank y'all so much. It's because of each and every single one of you that these programs have become what they are. And I'm grateful for each and every single one of you taking time out of your busy day to hang out with me. All right, I'm going to be back next week with another incredible guest. I can't wait for y'all to join us then. So remember, until then, be good to yourself, but more importantly, y'all be good to each other. Take
Amen.
care.